Hi, and welcome to Integrative Cancer Solutions with Dr. Karlfeldt. A cancer diagnosis is one of the hardest slap in the face imaginable. All of a sudden, you have to become an expert in cancer and its treatments because your life depends on it. Oncologists, family, and friends are pushing you towards chemo, radiation, surgery, and yet you feel there are additional solutions out there. You don't feel confident in that only traditional therapies will take care of it. You may, as I have, seen family or friends quickly go downhill from harsh medical treatments. There is a better way. I invite you to listen to stories from real people fighting cancer successfully through powerful, integrative, and holistic methods. Learn what they did. This is my gift to you to make the learning curve less steep after your diagnosis. The information in this podcast could save your life as it has others.
Well, Angela Lima, it's such an honor and pleasure to have you on this segment of Integrative Cancer Solution. We met just a few weeks ago, and I got to watch a little snippets out of the documentary that was created, documenting your journey. By our friends, Dr. Z and Mama Z, that put it together. It's such an honor to have you here today.
Thank you so much. I'm so blessed to be able to be here and tell you my story 5 years later. And I'm so excited to just kind of share how my eyes were open to the world of integrative healing, a little bit about my journey, and dive into the Hope for Breast Cancer documentary. Because if people on a journey haven't seen it, I definitely think that it could be a valuable tool, if anything, to align you with some questions to ask your doctors as you prepare for your own healing.
Yeah, I love it. Yeah, because tell me a little bit how it all started. I mean, you live your life, and then all of a sudden, so tell me a little bit, what happened when you get diagnosed.
Yeah, so a little bit of background on me. I've always been in the performing arts industry. Growing up, I was a musician, I was a singer, I was always very aware to keep my body in perfect shape. I was a dancer, I cheered professionally in the NFL for a couple of seasons. And so nutrition and diet, exercise, all huge components of my life. And after I got married, they were still a big part of my everyday. We were very blessed early on in our marriage to find out that we were expecting our first baby. And instead of kind of embracing my pregnancy as I'm eating for two, it was more, how can I have the most nutrient dense diet during this pregnancy to make sure my baby's getting what she needs? And then also, how can I support my body during this pregnancy so afterwards I'll be healthy and will be able to breastfeed? And so after the birth of my daughter, I was able to breastfeed her for about a year, and figured that was going to be the best thing I could do for myself preventatively for breast cancer. It wasn't a concern in my family. We had no family history of cancer, with the exception my grandfather passed away of lung cancer, but he was a part of the bombing in Hiroshima in World War II and was an avid smoker. So aside from his passing, no family history of cancer whatsoever. I was just taking preventative measures because I knew it was best for the baby and also best for me. And so when my daughter was about 2 years old, we had been on a family vacation. She was running around playing, and she happened to lose her footing and speared me in the breast with her elbow. And I remember calling my mom, just saying, hey, if something develops, she fell at a really weird angle. It really hurts, but it's nothing. I know it's nothing. So just calm me down if something develops. Well, a couple of months had passed, and one morning I was in the shower, just, showering, and I happened to graze across my chest and felt a lump. And immediately my heart sank. I wasn't thinking about the fact that my daughter had fallen. It was just, oh my goodness, what are we dealing with here? And I remember waking up my husband saying, hey, do you feel something? Am I being overly anxious about this? And he's like, I bet you're fine. I went to the doctor. The doctor said, you're fine. It's probably just scar tissue. I wouldn't worry about it. It doesn't feel like breast cancer. And so I let it go for a little bit, but I decided to seek a second opinion, maybe a month or two later. And the second that doctor started doing their evaluation, her face changed, the demeanor of the way she was approaching me completely changed. And she's like, we have to get you into radiology right away. We need to do a mammogram. And I come from a more holistically minded family. Mammograms weren't on my radar, but when you're in a moment of panic because you see a medical professional literally change night to day, it was like, okay, I'll go. And I ended up going to see the radiologist. I had the mammogram. And within, I would say, 3 days of that mammogram, this small little movable lump became the size of about $50. And it was lumpy and textured, and I started to panic. I did have a thermogram done the day after my mammogram. I was able to get in and have a thermogram done. At that time, she had given me peace that, there was no blood flow. It looked like everything, was a little bit more on the scar tissue side. But I really think that I probably was dealing with something teetering on the verge of cancer, and that mammogram, quite frankly, could have been the ticket it needed to just transfer sides there. And so I ended up waiting another couple of weeks, and I went to a breast surgeon here in Nashville, Tennessee, where I reside. And he said, I can do an ultrasound guided biopsy. I think it's in your best interest if we do so. And within a few days of having that biopsy, it was concluded that it was ER/PR negative, HER2 positive breast cancer. And our world completely stopped. We were just shocked and saddened. And I'm very much a person of faith. I feel like during that time, God was really speaking to me and kind of putting things on my heart. Again, coming from a more naturalistic mindset, I knew that conventional medicine was not on my radar. But you go through the motions, right? You go through the motions and you speak to the doctors and you outweigh all of your options. And I remember walking into the oncologist office, just hating every minute. I was a 31-year-old young mother. Everybody around me was much, much older. Everybody looks weak and pale and frail, and it just didn't suit me. It didn't fit me. I didn't like the way the oncologist spoke to me. I didn't like anything about it. And I remember sitting in the chemo ward that day as a nurse was explaining to me what my recommended protocol would be. And I looked at her and I said, honey, all due respect, this is not for me. I'm going to listen to you. I'm going to be polite, and I'm going to walk out the door, and you're not going to see me again, because this is not who I am. This is not what I believe in, and I shouldn't be here right now. And she said, okay, thank you. But we signed our paperwork and we were on our way. And I had told my husband about 2 or 3 nights before that appointment, God's going to speak to me and I'm going to know what I'm supposed to do. And he's going to answer these 3 things. And my husband and I grew up in rather different spectrums of Christianity. So he didn't exactly know where I was coming from when I said that I would hear God speak. But when we walked out of that oncology office, a complete stranger stopped me in the middle of the hospital and said, can I pray with you? And I said, yeah, who do you want to pray with? Or who do you want to pray for? And he's like, honey, I'm here for you. And I feel like God is telling me to tell you these 3 things. And it was like light bulbs, just one right after another. And I started to cry, and my husband started to cry, because one of the things I said in my prayer was, God, if you tell me that this is the path, I won't mistake it for coincidence. I will trust in your word. But I thought God was going to speak to me differently. And so I ended up doing conventional medicine. But when I spoke with my oncologist, I did tell him, I said, you will listen to me. I know my body better than you can read on any sort of blood work or CT or MRI. And I said, and when this resolves, which it will, all glory goes to God, because you're just the vessel. And he said, okay, kid, we'll see what happens. We are very fortunate. Within the first round of chemotherapy, I had TCHP chemotherapy. The 5-centimeter tumor completely dissipated. And so we were really excited. My husband was extremely hopeful, thinking, well, it's already gone, so we're good. You don't have to worry about coming back. And unfortunately, that wasn't exactly where the story ends. He had recommended we do at least 5 preventative treatments. On the 4th treatment, I actually had received the chemotherapy wrong. They administered it too fast, and I had become severely, severely sick after that, going from about 100 pounds to about 87 pounds within a couple of days. And, I went back to my next appointment and I said, I have been praying on your heart, sir. And I really hope that you're digging down deep. And when you look at those records today, that you find it in your heart to stop, because this is me telling you, there is no more. I will not do this to my body. Like, your goal was to have me live for my daughter, but this quote unquote medicine is killing me. So we're going to stop. And he agreed. He agreed that it was time. And at that point, he said, we should do preventative radiation, which from the get-go, that was not. God spoke to me clearly. That was not something I was interested in. That wasn't something that I was going to look into further, especially just after asking, questions. I was 87 pounds. I didn't have a lot of body fat on my body. The tumor had, essentially resolved itself. And I thought, what are you radiating on? There's literally no fat. There's no nothing. And that radiation is going to go directly over a lung. I had just researched too many incidents where secondary cancers had developed as a result of radiation. And I said, no, I'm not going to do that. And so then his next suggestion was to have a radical mastectomy. And I said, no, we're not going to do that just yet either. And I want to pursue different options. And that's where Sabrina and Eric come in, because I had grown up with Sabrina. I've known her since I was probably 10, 11 years old. She's always been such a shining light in my life, especially after my daughter was born, because I went to her. Sabrina has a beautiful family. She has 6 beautiful kids. She was the first person I called to just say, hey, this new mom thing, this is scary. Is this normal? And she was there for me every step of that way. And this journey was no different. And I remember her saying, if you had an opportunity to heal differently, would you? And it was like, absolutely. And she said, well, we have an opportunity for you to go to Mexico and be treated at Hope for Cancer treatment facilities. And we would like to be a part of your journey and document your experience if you'll allow us to. And that was probably the single most greatest gift anyone has ever given to me, because I feel like, I had the perfect blend of both worlds and support from both conventional and integrative medicine. But I truly believe it was everything that happened at Hope for Cancer that allowed me to truly heal my body and understand what happened, understand why it happened, and understood how to prevent it moving forward. And so it was a really incredible experience. I went to Mexico for 3 weeks, had the opportunity to just receive really the most cutting edge technology, I feel, when it comes to integrative healing and cancer treatment in general. And, our journey had hills and valleys there too. It wasn't smooth sailing. It wasn't, a one and done. I always tell people healing is not one size fits all, and it's definitely not a one and done approach. This is a lifestyle, and it's a lifestyle moving forward.
So at that point, because at that point you had no evidence of disease at that point, correct?
Mm-hmm. Mm-hmm. We had scar tissue develop that we were monitoring, and both my conventional doctor and Dr. Tony Jimenez, my doctor at Hope for Cancer, had said that's quite normal when you have a tumor of the size that it was, for it to go away so quickly. Scar tissue is almost inevitable at that point. And so when I went to Hope for Cancer, we did have scar tissue that had developed, and we were monitoring it. And I think this is where mindset comes into, because I'm a firm believer that you can persuade your mind to think of healing, and you can persuade your mind to think otherwise. And so if you're constantly touching, assessing, thinking, worrying, Dr. Tony himself says a bad thought can kill you faster than a bad germ. And so, I think at that point, I wasn't quite at a place where mentally I was accepting full healing. It was a surface accepting full healing, but inside thinking, what if? And actually, it was December of 2018. I remember going in for a follow-up visit. I was there for a couple of days, and I spoke with Hope for Cancer's radiologist. He had done an ultrasound and said, I don't love how this looks. It's not fully developed, its own blood source, if you will, but it's maybe something we should biopsy, something we should consider looking into moving forward. And so I said, okay, like I was contemplating having a mastectomy just for peace of mind. I didn't want to constantly assess or touch or feel or worry. And so it was right around the holidays, and I knew that we would probably have to wait a while for the results to come back, but they did the biopsy. On January 3rd, Dr. Tony had called me and said, well, and you're doing really great. Some things to report. It's mostly necrotic tissue, lots of dead cells, but I do see a couple of active things in there. And I said, Dr. Tony, I just found out yesterday I'm pregnant. And it was a complete unexpected miracle pregnancy. For one, after going through traditional chemotherapy, I was told I would never be able to have children again. And quite frankly, I always joke around and say I have no idea how I got pregnant because I was too focused on my healing to be thinking about that sort of situation. So I truly believe, Dr. Tony said, Angie, this is a miracle and I'm happy for you. And that's exciting news. But I need to reevaluate and come up with a new game plan, and we figure things out from there. And he got off the phone with me, and not 2 hours later, he was back on the phone with more recommendations. He happened to bless me with some information about a surgeon in New York who had been performing CO2 laser mastectomies. He was the only one in the world at that time to be doing such a thing. And fortunately, I was able to get into him within just 2 short weeks, where I was able to have the CO2 laser mastectomy. The recovery was incredible. The whole surgery itself took, just a couple of hours. Since it was a laser guided surgery, my healing was rapid. That evening, it was an outpatient procedure. I was walking on a treadmill with my husband. I was up and around. I toured Manhattan just 24 hours later, kind of living my best life. And what's really incredible in that whole scenario, and kind of how I think everything has a time and a place in your life, is when my pathology report came back from him. He had said, kid, you got an angel looking out for you, because we did your pathology and everything came back normal, clear. You have beyond clear margins. There's not a cancer cell in this tissue. Go live your life, have a healthy baby, and live forever, happily as can be. And I think what I truly think had happened, to incorporate everything I had been incorporating, setting my body up to be able to heal that the way that I had at Hope for Cancer, it allowed me the opportunity to conceive this miracle pregnancy. I truly believe never would have been able to get pregnant had I not gone through the detoxification and the supportive therapies and the natural cancer fighting therapies that I had at Hope for Cancer. But then in addition to that, getting pregnant and knowing the research behind what the development of your baby can do to your own body to heal itself, I truly believe my son was sent here to heal me completely. And so, we are embarking on 5 years. And it's just been an incredible ride. I still go in. I have a great relationship with my conventional doctor, even though I'm pretty sure I'm a thorn in his side sometimes. I do see him every 6 months. We go in for assessments and scans and blood work, and praise God, everything is healthy and natural and normal. But I am still incorporating to this day all of the healing techniques and therapies that I used at Hope for Cancer 5 years ago are still a part of my everyday life.
So to kind of back up a little bit, so at Hope for Cancer, what were some of the therapies that you were receiving? And I'm really curious as to what the therapies that you're incorporating into your daily life, what that is now. But what did the treatments at Hope for Cancer look like? And what were their benefits, and why were you getting them, from your understanding?
From my understanding, so Dr. Tony, a couple of his core therapies that he utilizes is sonophotodynamic therapy, which is going to be the sound and vibrational therapy. That was specifically used to target the tumor itself. And so I would do a series of rotations with that specific machine. It's an ultrasound machine, daily for a recommended time as set by Dr. Tony. And we did that inevitably until I had my mastectomy. And so that was a procedure I did every day. Now, that's not something that I personally utilize anymore at this time. Another avenue of therapy was photodynamic therapy, which is light therapy specific. And at the treatment facility, it's a little bit different than your home therapy program. So at the facility, it was lasers that were, inserted intravenously into your bloodstream, and, it was targeting different things. You receive an activator. And so that light process is a little bit different. But upon going home, I received a watch and an activator. And so that was really targeting any free radicals within my blood flow. And I would just put my watch on twice a day. I did that more often during my active healing, but it's also really good for allergies and when you're not feeling your best and things like that. So it's still something I pull out on a regular basis, just to really help my body. I feel energized after I do that specific therapy. Some of the more targeted therapies, like we did Sunovera and Celgina at that time, those are therapies that I stopped once I had become pregnant. And so those weren't things that I had continued to do after the baby was born. But I'm still doing hyperbaric oxygenation. I'm still doing full body hypothermia. I'm still doing near infrared lamp therapy, the diet, the exercise. I'm working on the recall healing aspect of things, which now Hope for Cancer calls their BEST program, which is behavioral, emotional, and spiritual healing. And so that was such a big component that I didn't realize I was in need of, specifically when I went to Hope for Cancer. But something that I notice now as something everyone should actively be doing, but I continue to do in my everyday life, because growing up the way that I did, being a part of the performing arts industry, having constant quote unquote judgment for the way I looked, the way I sounded, the way my presentation was, I was really harboring a lot of negative feedback that maybe I didn't process well during the time. And so I built up all these layers of protection. But when I start to really focus in on, okay, what do I feel could have contributed to this diagnosis? Because truthfully, it wasn't diet. It wasn't lack of exercise. I was taking care of my body, but emotionally, I was not in a position where my body's terrain was in the place to be healed and whole. And so that's a big component, working through things, processing things, having the voice to say, yeah, no, that's not okay. I'm not going to accept you to speak to me that way. Or, like embracing who I am, what I look like, how my body is, all of those things that maybe I hadn't done for so many years because I was seeking validation of others. And their opinions of what they thought I should be, and trying to live up to an unrealistic expectation. That was a huge component to heal. And not saying everybody's going to have a similar story to mine. Not everybody grew up singing or dancing. But it's interesting when you really start to peel back the layers of what makes us who we are, what makes us tick. Most everybody I met in the clinic had something very valuable to say about their experience in that aspect of healing. And it's funny, as I'm sure the emotional connection to breast cancer is the right side is male dominated and the left side is female dominated. And the entertainment industry is full of males. And I was dealing with a right breast cancer diagnosis. And then I really started to look at where I was in my life then. After my daughter was born, I took a step back from performing. I worked in marketing, but I worked with all men. And every day was a struggle. Every day I was fighting to get my voice heard. I was the youngest by, 20 years in a group of, really sweet, but good old Southern boys that just, would pat you on your head and tell you, good job, sweetie, and move along. And then I thought, oh my gosh, I was taking all of that in, and I was really unhappy at work. I was, balancing the idea of being a new mom and a new wife. And, I think a lot of it had to do with the emotional stress that I was under. And I recognize that now. So that's something I really work to correct.
Yeah, that's such a powerful lesson, I would say, for pretty much everyone. I mean, for me, I don't think anyone gets any kind of cancer without an emotional component. Mm-hmm. I mean, that it's I mean, yes, you see physiological changes, and cancer looks very physical. It's there, it's a lump, that's a physical lump. But in reality, there's always some emotional components that is changing that environment, creating the tumor. And yeah, tell me a little bit about recall healing. I mean, because I know I interviewed another person that does actually teaches that recall healing, and it's such a fascinating tool. So tell me a little bit about that and how you utilized it and how it impacted you.
So I'll admit, when I first went to Hope for Cancer and was told that I would be participating in recall healing, thought it was a little woo-woo. Even for me, being open-minded and being integrative, I'm like, that is not up my alley. Like, no. And it was interesting. We had to fill out this little questionnaire before we had our first consultation with the therapist. And it was writing how much you knew or how far you could go back of all of your family members. So my grandmother, what was her placement in line? How many siblings did she have? How did her parents die? Do I know about their parents? And, on all sides of my family. So paternal and maternal, grandparents, my parents, where did they fall in things? And so I wrote all of this down. And I remember walking into the session, Dr. Leslie was my provider at the time. And I said, I'm going to just cut us all off at the pass. I was popular in high school. My parents are still married. I love them a lot. I've had some weird relationships in my life, but nothing I haven't, embraced, forgiven, and moved on from. I'm like, I'm fine. Everything's fine. So what do you want to talk about? And she kind of just laughed and said, okay. She goes, why don't you take a seat? I'm like, okay. And she said, all right, so let's look back at your family history here. And she said, okay, so what happened when you were 9? And I'm like, well, my great grandma died. And she goes, and what did that mean to you? And I'm like, well, she was the matriarch of my dad's family. And, we had big family dinners all the time. She had 7 kids. And so when everybody would come together, it was a lot of fun. But then when great grandma died, that stopped and our family kind of spread apart. And I mean, it was sad, but she was 94, lived a good life. And I'm trying to find the swing of it. She goes, okay, what happened when you were 13? And I'm like, my brother's best friend died in a car accident. And she goes, oh, yeah? Like, yeah. And the tears are just starting to come, and she's like, okay, and how did you process that? I'm like, well, not very good, and just going on. And it was like she hit key life-changing moments in my life based on a questionnaire I filled out about my family and my grandparents' families and the placement of everybody. And I remember just thinking, like, this is bizarre. How would you know how I'm connected to this, how those experiences happened to me in those years based on that information? And it was like a light switch went off. And I couldn't look at Dr. Leslie moving forward without just bawling, without crying. And I didn't grow up crying. We are not an emotional family like that, or we hadn't been. I think we've much since softened since this experience. But, I just remember thinking, wow, there's a lot of things that I was born generationally into that I maybe didn't realize I held on to until Dr. Leslie opened my eyes. And something that was really fascinating to me was my name, because when I was born, I was actually given a different name. My name was Leslie Kim when I was born, and that was to represent my mother, who had a sister who was given up for adoption. Her name was Leslie Kim. My dad's name, ironically, is Kim. So it was like homage to the sister she didn't know, respect to my dad. And my dad's mother was like, you can't do that. You can't name her Leslie Kim because there's sadness attached to that name. And you just can't name her that. So then they named me Angela because Angie Dickinson was giving an interview on TV while they were in the hospital. So that's how I got my name. And I was Angela Susan after my dad's sister, who was a stillbirth. And yet still I was associated with a form of sadness. And so when I spoke to Dr. Leslie, she was like, Angie, from birth, you were already inheriting some weight that you wouldn't realize until now that we're talking about it. And so many things made sense. And I wish that I knew, the full science behind it, where I could speak to you the way Dr. Leslie could give this presentation. I can't. But what I can tell you is that was truly the most remarkable experience, to be able to physically feel things unlock within my mind and in my heart that I might not have ever been able to address had she not brought it up. But all of a sudden things made sense, different actions in my life, the way I was treated, and I had to do forgiveness that I didn't realize I needed to forgive along the way. I had written several letters to individuals throughout my life, some of which I physically sent, some of which I physically burned, but I had to release all of that weight that I had been carrying, because I knew I didn't want my children to carry that weight. And we unknowingly do pass that along from generation to generation. So it was an incredible experience. And I truly do believe the mind-body connection when it comes to a diagnosis.
Yeah, it is fascinating what you said. I mean, exactly how you walk into that meeting, the initial meeting, and my life is fine. Everything is fine. And you don't recognize these kind of underlying factors. They usually recall healing to talk, about the iceberg. The tip of the iceberg is kind of your life, what you see, and then you have the rest underneath the water, the sea level. There's just brewing there, and these are generational things that you consciously wouldn't even kind of think about, or different aspects in your life that you kind of blocked away because you don't have the ability to process it. So it's there subconsciously, but consciously it's not part of your life. And here it is. It's just kind of impacting your immune system, your energy system. It's impacting all of these things, and you really have no idea that it's there. So that's when these kind of therapies, when you deal with something like cancer, that you all of a sudden you're blindsided and say, where did this come from? That's when you need to look under the hood and really kind of analyze and see, what is it that, that I'm missing? What is it that I'm not seeing?
Mm-hmm. Absolutely. And I remember, specifically having been born with a different name, that grandmother treated me as if I was that child. And I remember growing up, I would get these weird months, literally months, where I would just get so sad and so depressed. And I didn't understand why, until Dr. Leslie came along and explained to me. And she's like, honey, you were carrying that child's presence. You were that child to your grandmother. You took on that pain of having to let her go. And, I've never met the woman. I do know who she is. I've never met her before, but I wrote her an email. And I said, I know this sounds so silly. I always assumed that I would write you a letter someday about my mom, but I have to let you go because I've been carrying you around my whole life. And I just want to let you know, I wish you nothing but love and happiness and great health. I let you go now. And I hit send, and it was like a weight had just been lifted off. And so that was really an incredible experience. And again, I think it's something that nobody really wants to dive into. Nobody wants to feel that exposed. But once you do, it's life-changing. It's literally life-changing.
Yeah. And these are the things that programs our genetics, our DNA, the genetic behavior of a cancer cell. I mean, these are the things, and that's why it's so important. I mean, over and above all these other fancy therapies that that Dr. Tony and myself, and other, providers do. But at the core of it, it's these kind of, this type of energy. Yeah, and another, I don't know if, and some people don't realize also is this a term called the vanishing twin syndrome. I don't know if you heard about that as well.
I believe I have.
So a lot of us, as we develop in the fetus, there may be then that there are twins, and then there's a understanding between the two individuals that one will live and the other one will sacrifice himself because there's not enough energy for both to survive. And so then you carry the living person, the one that gets to survive is carrying that burden of one sacrificing their life for you existing. And how they so that's a big deal to process that emotion of seeing your twin sacrificing themselves. And it is fascinating. It's more common than you think. It's up to like, I think it's like 30% or something like that. So it's a big deal. And so to process that as well, and yes, obviously nobody remembers what happened in utero, but it's there. And to use these kind of therapies, like the recall healing and the number of other ones that you can use as well, to process things that you obviously consciously wouldn't have a clue about, becomes so important in this journey. So yeah, it's powerful that you get to do that.
And just recognizing too, one of the things that I had also done was hypnotherapy, which can be very controversial, especially coming from the Christian faith. But I had a Christian-based provider that I was working with. It made me feel even closer to God. But it was recognizing, like, if I can connect with God about my divine healing, I can set my mindset to believe that my body can heal. Our minds are such powerful tools. So when you incorporate that, like just focusing on how your body can process and how your body can heal, and then pairing it with the recall healing, it's really an awesome tool to be able to work with.
Yeah, that's really cool. Well, and I have to be honest with when we were watching a piece of the documentary in your journey, that moment when they were shaving your hair. The gal is sitting by me and myself, we were tearing up, and just kind of seeing your emotions going through that, where you're trying to be brave, and then at the same time, here you're identifying yourself with your beauty, your performance, and like you're saying, you're judged by how you look and how you perform, and here you're shaving, getting rid of one of the biggest assets that a female have, which is her hair. Can you tell me a little bit about what was going on? And because that was just my interpretation of it. And can you tell me a little bit what was going on in you at that time?
It was interesting. To be honest, I haven't watched the documentary since it first aired. And so it's been about 4 years now since I've had an opportunity to sit down with that. And being in the audience and hearing the clippers turn on before they started playing the movie, I started to tear up, because I think in its human nature, we do build up defenses, even though I work to process. I give thanks for the experience and I try and move on from it. But that was just a placement back in time. And so you're right. At that point, in that moment, I was trying to be brave for me. I was trying to be brave for my husband. Thank God I have such an amazing, loving, wonderful husband who, one, volunteered to help me shave my hair, and he could be a part of the process himself. I don't even know why we recorded that. To be 100% honest, there was no talk of the documentary at that time. I don't know why we recorded that. But I was on FaceTime with my mom, and she said she wanted to be a part of it too, even though she lives in another state. And I remember thinking, like, don't cry. You don't want your mom to see you upset. You don't want your husband to see you upset. It's okay. It's going to be okay. And joking, like, oh, I always wanted short hair, and and then she said something to me like, are you okay? And I say, I'm fine. And your voice cracks. And even now, talking to you, it's bringing it all back to the surface. Nothing can prepare you for that. But if you look for the beauty, I remember afterwards, after we obviously stopped taping that, and when I was home alone in my bedroom that night, I remember thinking, okay, who you were before led you to this point. This person is not the best version of themselves. So we're going to strip it away. We're going to start fresh. This is your clean slate. The hair is gone because that person won't exist moving forward. So today you start rebuilding. And it was flipping that mindset instead of sitting in the suck, which sometimes you do. It was like, okay, you know what? Who I was 5 minutes ago was sick. This is my clean slate. I'm going to be healthy moving forward. And I started to look at, when my hair would grow back, it would be because it's healthy, and my new approach to life, I'm going to be healthy, so that was kind of the death of the old me. And this was the birth of the new me. And so it was an emotional day for sure. I'm just so grateful that I had the love and support of my husband, the love and support of my mom. It was too much emotionally for my dad to be a part of. It was too much emotionally for my brother to be a part of. They were equally as supportive in the ways that they could meet me there. But that was a pivotal moment in my healing where I thought, okay, that's the end of the old me. This is the new me moving forward.
It's like Phoenix rising, Christ coming out of the grave, and Lazarus waking up. Oh, yeah, that's really cool. Well, Angela, it's such a pleasure, such an honor. Thank you so much for the joy that you bring to the world, for your story, for your the hope that it brings to people. So thank you so much. Thank you.
Absolutely. I'm grateful to be a vessel of God's testament, and I'm very grateful today that you allowed me to be a part of your podcast.
The information in this podcast is for educational purposes only and is not designed to diagnose or treat any disease. If you'd like to know more about what my center offers, please visit thekarlfeldcenter.com. Please join us next week for another live consultation with a patient diagnosed with cancer on Integrative Cancer Solutions with Dr. Karlfeldt.